Why do pelvic inflammatory disease infections keep coming back? Imagine fighting off an infection only to find it returns again and again. That's often what happens with pelvic inflammatory disease, or PID. The main reason is that the infection wasn't fully cleared the first time. Sometimes antibiotics are taken but not finished completely, leaving behind bacteria that can hide in the reproductive organs. These bacteria can then cause inflammation to flare up again. Another big factor is reinfection from sexual partners. PID is frequently caused by sexually transmitted infections like gonorrhea and chlamydia. If partners aren't tested and treated at the same time, they can pass the infection back and forth. This cycle makes it hard to fully get rid of the bacteria, leading to repeated episodes of PID. Damage to the reproductive organs also plays a role. When PID occurs, it can cause scarring in the uterus, fallopian tubes, and ovaries. This scarring can block or damage these organs, making it easier for bacteria to invade again. The immune system might also struggle to fight off new infections in these scarred areas. Some women have infections that don't cause obvious symptoms, known as subclinical infections. These can be caused by bacteria like chlamydia or mycoplasma. Because they're not always noticed, the infection can persist quietly and cause ongoing inflammation that eventually leads to recurrent PID. Bacterial vaginosis and imbalances in vaginal bacteria are also involved. Bacteria such as Gardnerella or anaerobic bacteria can cause inflammation outside of sexually transmitted infections. These bacteria are often harder to eliminate completely and can cause repeated infections even if a woman has no new sexual partners. Certain risk factors increase the chance of PID coming back. Women with multiple sexual partners, those under 25, women who have had previous infections, or those who don't use protection are more likely to experience recurrent PID. Endometriosis can also complicate things because it causes pelvic inflammation, which might make the reproductive tissues more vulnerable to infection or make diagnosis more difficult. Repeated PID can cause serious issues for fertility. The ongoing inflammation and scarring can block fallopian tubes, leading to infertility or increasing the risk of ectopic pregnancy. It can also cause chronic pelvic pain that affects daily life. Because endometriosis already causes pelvic inflammation, having PID on top of it can make symptoms worse and complicate treatment. In summary, recurrent PID happens mainly because the infection isn't fully cleared, because of reinfection from untreated partners, damage to reproductive tissues, or persistent bacteria that are hard to eradicate. Preventing it involves completing antibiotic courses, ensuring partners are treated, and managing risk factors. Always consult a healthcare professional for personalized advice and proper treatment to protect your fertility and pelvic health.